What are the risk factors of diverticulitis? Because you need to know it. So I need somebody to read this case for us, please.
42-year-old female presents to the emergency room with a history of left lower quadrant pain, which has been ongoing for the past 3 days. Temperature 37.9 degrees Celsius, BP 107 mm of mercury, pulse 78 beat per minute. You make a diagnosis of diverticulitis. What risk factors will you inquire about?
Beautiful. Please, everybody type your answers. TDM, CDM, CDM question. You know, people ask Dr. Bruni, I want you to give us training in CDM. That's what we are doing, right? CDM, CDM, please type your answers. CDM, 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 type your answers. What are the risk factors of diverticulitis? What are the risk factors? 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 Dr. Med, beautiful, beautiful. You are on fire for the exam. High fat diet, obesity, increased red meat, excessive alcohol intake. Beautiful. I like that. Dr. Inflammatory bowel disease, smoking, ulcerative colitis. No, Dr. Nusrat, out of that, only smoking and obesity are the risk factors. So what are the risk factors according to standard texts? Number one, high intake of red meat. High intake of red meat. Number two, high intake of refined grains. High intake of refined grains. Number three, sedentary lifestyle. Sedentary lifestyle, right? Number four, obesity. Obesity. Number five, smoking. Smoking. So if you have a patient with diverticulitis, you also want to encourage smoking cessation, right? Number six, alcohol consumption. Alcohol consumption. Number seven, medication history, use of corticosteroids, NSAIDs, menopausal hormone therapy, and opiates. So you want to also know part of your learning to know some of the medication classes which can predispose somebody to acute diverticulitis. Steroids, NSAID, menopause, hormone therapy, opiates, right? And then family history of diverticulitis. These are the risk factors. These are the risk factors. These are the risk factors of diverticulitis. Risk factors of diverticulitis covered.